So today we have homeopath Lisa DeCandia to talk about a few topics that may be of interest to parents and women. Lisa has a successful family-based homeopathic practice for over 13 years and has a lot of experience in children's health as well as women's issues. So let's talk about the topic of ADHD, attention deficit hyperactive disorder, and ADD, attention deficit disorder. Now, some statistics say up to 14% of children in North America are diagnosed with these conditions. So with your experience with treating children, does one occur more frequently than the other?
Well, I wouldn't say one occurs more than the other. A definition of ADD, attention deficit disorder, is basically the inability to sit still, to focus attention, and to control impulses like touching or screaming inappropriately. The ADHD just adds the hyperactivity component to it. Diagnosis of ADD and ADHD tends to be before the age of 7, and boys are diagnosed 4 times more than girls.
That's hyperactivity?
For both of them, yeah.
Why is that?
That's a very good question. I don't do the diagnosis, but research has shown that typically boys are diagnosed more. Makes me wonder, boys tend to be more energetic at times. But I'm not, I know the diagnosis that if, for instance, the inability to sit still, focus attention, and the impulse control, if that's noticed behavior, and I'm talking very increased behavior for more than a period of 6 months, then typically these children, the parents will be asked to take the children for a diagnosis.
Oh, okay.
Yeah.
Now, do you find the parents combine standard medical treatments with homeopathy, or do they usually come to you after they've tried the rest?
Well, I guess it varies from my practice. Many standard treatments are tried, such as Ritalin, for example, and these standard medical treatments at the beginning actually are quite effective, but research again has shown over long periods of time that these medications are actually the efficacy of them are about the same as behavior therapy. So there is starting to be increased research saying that, how effective is Ritalin. And I'm sure for some kids, and sorry, I'm just picking that particular one, but there's a lot out there. It is very effective, but again, you've got to think about, a long period of time. And I think that's when parents start to wonder if there is an alternative form of medicine. So they will come to homeopathic treatment. And the beauty of homeopathic treatment is, for example, if a child is on a particular medication, the parents will decide with their doctor to either reduce the medication or not, but homeopathy can work together. And that way allows the child to be more effective going through both of the treatments and hopefully reducing the medical one if that's possible.
Oh, okay, so there's no implications with the medical treatments with the remedies?
With the homeopathic medicines, no, there's no contraindication. Yeah, so I have kids that, for example, will start out in treatment, they'll be on a particular medication, and over a period of time of homeopathic treatment, the parents will take the child back to the doctor, and in consult with the doctor, they will decide to reduce the medication bit by bit.
That's good.
Yeah, it is. It's very good.
Have they ever been completely off?
There are some. It depends. Wow. It depends how severe it is, right? But many children, again, given how severe the diagnosis is, many of them have been able to get right off the medication.
Wow, that's really good.
Yeah. And
the doctors are okay with hearing from their patients like, oh, I'm taking homeopathy?
Well, I think we all want the best for the child. And again, if the child is functioning well, then, the parents and the doctors can decide to reduce the medication. Why not?
That's true. Now, do you have any advice for parents who are suspecting symptoms of either conditions in their children to do?
I think in terms of diagnosis, Again, the parents that I see, they've already been approached, let's say, by
Oh,
someone at
okay.
the school, and a diagnosis has taken place. So they don't typically come to see me prior to the diagnosis.
Right.
Some of the things that I do notice after homeopathic treatment, things that can reduce, for example, restlessness will reduce. And then it's easier to focus attention. So their focus of attention increases. Impulse control, as I explained, such as random touching or screaming, that will reduce with homeopathic treatment. So many of those issues, because the child is being balanced, you could say, through homeopathic treatment, are reduced. There are a few things that I would suggest to parents, and many of them already know this, that especially if their child's been diagnosed. But if they do suspect that their child is, let's say, ADHD, avoiding certain things are important, especially whether they're doing homeopathic treatment or not. Avoiding processed foods like cereal, for example. Avoiding aspartame, food dyes, such as, in food coloring, like in cakes. Red dye, green dye, avoiding sweets. I know that's a tough one. Of course, avoiding wheat, gluten, and dairy. All of these, parents will even tell me, my son went to a birthday party, he had a little bit of cake, and what a difference in behavior. The hyperactivity kicked in. So it's an important thing to consider, and I know that with your kids, you don't want to take everything away, but you really can see results by reducing some things. Even excessive time with video games. There's been some research out there that contributes.
Yeah, I've seen that.
Yeah. Adding things like omega oils, cod liver oil is an important thing, and magnesium. Magnesium really helps to calm the nervous system down. So parents, again, with their health practitioner, can discuss these types of things to see what they can add to the diet, what they can take out. I think they'll make significant changes in their child.
Okay, well, thank you. Well, I do actually have one more question.
Sure.
Some of the medications out there, in your opinion, do you find that if they're taking it for a lengthy period of time, does it kind of trigger the condition?
Well, some of the side effects actually of some of these medications are, for example, increased restlessness. So again, that's something that I think that parents and their doctor should be monitoring, because side effects can happen, and so they'll have to have a discussion. But yeah, read the side effects. That is one of them.
Read the side effects. Thank you.
You're welcome.